Hi everyone. Just going to take a little bit of time today to reflect on my spine evaluation and see how I can improve what I do well, what I can do better. I'm just going to take a moment to reflect on everything. So personally, I don't think I'm the greatest at spine evaluation. I recently have had some more experience with it, and that I have a lot of patients with back pain, and so I'm working through it. It's something that I definitely need to get better with. Uh, I don't think I'm very good. The back isn't really, it's very complex, and I think it just seems like it's such a hard and big challenge to tackle, which is why I don't really, I'm intimidated by it, I guess is really what it is, what it comes down to. So in that respect, I'm really not, I guess it almost seems like too big of a challenge to take on. But I know that I can do it if I put the time and dedication into becoming better. So just starting from the beginning, I think one thing that I do well is I think I take a pretty good history. I wouldn't say I'm super strong at anything, but I think my history is pretty. I usually take a pretty good history, and I think I do well with patient interaction. But I don't. I mean, the special tests. I think special tests, palpations. Like I have trouble difficulty remembering all the special tests. I remember like one or two for each pathology, but seeing how special tests aren't that specific, I really need an arsenal of them. And then my palpation skills are, I think they're decent. They could be better. And again, I haven't, up until this point, I haven't had too many back injuries until I had about 4 or 5 volleyball players who now have back injuries coming towards the end of the season. So we're looking into that, and I realize I need to get better so that they can get better. Yeah, my weaknesses for my special tests, I feel like I learned them, but in doing so, again, I haven't had much. I learned them in undergrad, and I really haven't needed to use them that much, so I haven't really needed to practice them. So I think my special tests, manual muscle testing, I don't really remember much of the manual muscle tests. And I also find that because there's so much pain, it's difficult to get them into positions to do things because they're just uncomfortable in the position, and it makes it difficult for everything. But that's no excuse. It's just something that I have to figure out a way to around or push through it. Um, so one thing that I do in my spine evaluation that I think is very useful is I always check the sacral angle, because I find that most patients, people have their sacrum is I'll say anteriorly rotated, and they have a large lumbosacral angle, and that usually I find some originates and causes some back pain, either as a primary or secondary cause. Uh, Another thing that I do is I usually like to, you know, palpate all the vertebrae to make sure that to see if anything's rotated. And in doing so, I usually take a Sharpie or something and put spots on the spinous process of each vertebrae all the way down, or in the region that there's pain, and see if there's some sort of muscular imbalance pulling a vertebrae one way or the other. Um, I think those are two things that are really helpful. Um, I think I think in terms of improving, I really need, like I said, I really need to do a better job with the special tests. I need to, and the anatomy, to be honest. I need to look over them, look over the special tests and the anatomy, and um, and just kind of study it so that I know it, and I know like, oh, if I think a patient has this, do the special test. Just again, I haven't used it much, and that's weakness. So I need to make sure that I use them more, or at least practice them more, even on fellow clinicians, students, and we can all kind of practice them together. I also need to work on. I want to like try and take on more back evaluations again for the practice reason. Where if I have more patients with back pain, I'll get more experience with it. And I'll get more comfortable with it, and for that reason, I think it will be very very useful. Um, I also think after the readings this week, I think the McKenzie exercise would really help me because back pain seems to be so diffuse and difficult to find in the originating area. If I can get it to centralize, um, it will make life so much, and let me be able to narrow things down and kind of isolate where the pain is a little bit better than this broad range of problems. Oh, excuse me. Um, I also think the Canadian C-spine rules. I really haven't needed to have anyone sent for imaging, but I definitely can see how if I suspect that someone needs imaging and I don't, I need to kind of get those memorized and get those down because if someone needs imaging on their cervical spine, that could be, a huge problem either later or in the near future, and it's something that I really need to make sure that we hammer home and can do with my patients if necessary. And then, I mean, again, like I said earlier, practicing those special tests is key. It's something that I think is probably my weakest point, if you couldn't tell by me saying it about 5 or 6 times already. Practicing those special tests, practicing my palpation skills, and knowing the anatomy. And I also think reviewing some of the different pathologies that occur at the spine, because I just feel like every time I go in, I always think, oh, I should have thought of that. Oh, I should have thought of, this could have been a pathology that I didn't think of. And I think that's very key, and especially with the spine, I feel like it's very intimidating because there's so much vital. This, the spinal cord goes through the vertebrae, and it's kind of intimidating. Where if you make a mistake, well, something's going wrong, and the pressure kind of builds up, and then it could be detrimental. So I think the pressure sometimes of the cervical spine or all the spine gets to me, and during my evals, and that I need to become more confident in my ability, and then move on from there and make good decisions. And yeah, so thanks very much for watching and listening to my problems. Bye.